A small but potentially significant moment in the fight against COVID-19, as 5 staff members of the new Roseland Community Hospital in Chicago receive a vaccine for the virus. But not everyone at the hospital is ready to take that step. A quarter of the staff has indicated that at this point they have reservations.
They're afraid because it's a new vaccine. They're worried about the side effects of it.
Jill Jean is a chief nursing officer. She hopes that by taking the vaccine herself, she can help dispel those fears.
I'm really ready for this pandemic to be over. I'm ready for my workers to stay safe and be safe. I do sense some fear though, and as their leader, I feel that me taking the first step will inspire them to see that it'll be okay.
The mistrust in vaccines at the hospital underlines the work that lies ahead to educate the wider community.
It takes some convincing sometimes, but we're prepared to do that. We start with our employees and then we take it to the community.
Much of the Roseland area on Chicago's far south side is considered both a food and health desert, void of fresh produce and accessible medical care. The neighborhood suffered a COVID-19 death rate 67% greater than the citywide average. Local lawmakers are hopeful they will get equitable access to vaccines.
It's always a concern that communities like mine won't be a priority because we were hit the hardest. So the vaccine should go into the communities that were hit the hardest, and if that's not the case, then that will be a problem.
This is still the immediate focus for staff at this hospital. This 10-bed intensive care unit has been overwhelmed with COVID-19 patients for weeks, and there are real concerns that crisis conditions will only further intensify until vaccines are widely available.
Tanetshia Brown is a critical care nurse in the hospital's ICU.
This is nothing that I've ever seen before. Watching patients die alone or go from being stable to now unstable in a matter of minutes has been very, very, very draining.
Brown hopes the vaccines will bring an end to the pandemic and reduce the impacts on frontline medical staff.
I'm hoping that, everybody can be on one accord, that we can have at least, 80% of the population, just go ahead and just do it because we're tired. Healthcare workers, we're tired. And everybody else can go about their life, and we can't.
The fight against the virus continues. In this community and many others across the US, the impacts are clear, but there is now light that the end is potentially in sight. Dan Williams, CGTN, Chicago.